Going to share my audience with you, my wonderful book club ladies who have given of their time for me, which I appreciate very much. Have you ever gone to your dentist begging for a root canal? I have 3 different times. The 3rd time I showed up, my dentist refused to treat me. Instead, she referred me to a neurologist who later diagnosed me with trigeminal neuralgia. According to trigeminal neuralgia researcher Joanna M. Zarakowski, trigeminal neuralgia is not well known among the general public or most practitioners, and it's for this reason that it's probably most often misdiagnosed. Now, I had never heard of trigeminal neuralgia before my own diagnosis, but since then I have done extensive research on the condition. Understanding trigeminal neuralgia and knowing the signs and symptoms could help someone get the relief that they needed in a more timely manner. Today, I'll tell you what trigeminal neuralgia is, what causes it and the signs and symptoms, and some treatments in the context of the past, present, and future. Let's begin with some of the physiology of trigeminal neuralgia. Trigeminal neuralgia is a neurological condition caused by damage to the trigeminal nerve root at the base of the brain. Duke University Medical Center explains that there are 2 major causes for trigeminal neuralgia. The first is compression on the nerve. This can be caused by a tumor or an arteriovenous malformation pressing on the nerve. The second cause is erosion of the myelin sheath covering the nerve. You can think of this as the insulation covering an electrical wire, and when it's worn away, things tend to short out. There can be erosion caused by friction with other tissues or from diseases such as multiple sclerosis, which erode the myelin. Now that we know a little bit about the physiology of what causes trigeminal neuralgia, let's talk a little bit about some of the triggers and the symptoms. There are 2 types of pain that trigeminal neuralgia sufferers generally feel. First is a constant ache and burn and throbbing pain, and the second is a much more sharp, acute pain. These pains can be felt on any of the 3 trigeminal nerve endings on either side of the face. Now, patients usually only feel it on one side instead of both. However, over time, according to the International Journal of Clinical Practice, the attacks will become more and more acute and closer together. Dr. Wolfgang Littke, another trigeminal neuralgia researcher, was trying to describe this pain and said, "Trigeminal neuralgia can cause some of the most devastating pain that humans can suffer." Now, we have looked at the physiology behind what causes trigeminal neuralgia. We have looked at the pain that it causes. Now let's take a moment to look at the triggers for trigeminal neuralgia. And the devastating thing is not just the pain itself, but that the things that cause the pain and trigger it are such parts of everyday normal life. Talking, eating, chewing, brushing your teeth, putting on makeup, shaving, a kiss, talking can all trigger a devastating attack. And for some people, according to Dr. Mark Oberman, even the fear of causing another painful attack is enough to interrupt some people's daily lives and decrease their quality of life. Now we know the physiology behind trigeminal neuralgia. We know the triggers and the pain that they cause. What you don't yet know is that there is no cure. Trigeminal neuralgia has no cure, but thankfully there are several treatment options available. Let's look at these options in light of the past, present, and future. But before we look at what does help trigeminal neuralgia, I want to share with you what does not work. Analgesic and opioid pain relievers do not touch trigeminal neuralgia pain. So in the past, cures and treatments were largely ineffective, and some were downright dangerous. Some poor souls in the past got nothing more than laxatives from their practitioner. Others got dangerous mixtures of chemicals with alcohol and opioids. This could leave them with paralysis or blindness or unconsciousness, which some thought was a success. But for others, it could cause blackouts, cardiac arrest, organ damage, and blindness. Now, trigeminal neuralgia has several treatments that are available today, which are much more effective. And the first line of defense is medications. There are two types of medications commonly used. The first are anticonvulsives. I myself take gabapentin every day. And the second are tricyclic antidepressants. And these are used to interrupt the signals to the brain for the pain. However, medications are eventually going to become less and less effective until they finally stop working. I myself take the smallest amount of medication I can get by with on a daily basis so that my medication can grow with my condition. After medication has stopped working, then it's time to transition to the second type of treatment, surgical options. The first option is to go in and remove whatever's causing the compression. The tumor or the arteriovenous malformation is removed. The second treatment option is for when the myelin sheath is worn away. They go in and put a little tiny sponge to cushion the nerve where the myelin sheath has gone away. But again, much like medication, surgery only has limited time. A surgical procedure can last from anywhere from 3 to 15 years, depending on the patient and the progression of the condition. After 15 years, if the patient is lucky enough to be healthy for yet another brain surgery, the procedure can be repeated. Some of the things they're looking for in the future for trigeminal neuralgia include Botox injections, gamma knife surgery, and electrical impulse stimulators to send electrical signals to interrupt the signals to the brain. But as in the past, if a patient cannot find sufficient relief, many times they'll seek relief the only way they can and turn to suicide. Thankfully today, we have more effective treatment options than in the past, and we are able to look toward the future. With the information that I have just shared with you, I could have avoided 3 long years of pain and searching for a diagnosis and a viable treatment. I was unaware that trigeminal neuralgia existed, and like most people, I didn't realize it was a neurological condition caused by damage to the trigeminal nerve. I was unaware that it caused extreme pain or that there were treatment options available. Perhaps someday, the knowledge that you have could help someone find the relief that they need. And perhaps, with more public education, trigeminal neuralgia will never again be known as the suicide disease. No.